right, welcome everyone back to the Press Box at IMSH 2023. My name's Lance, I'm the founder CEO of HealthySimulation.com. So excited to be partnering with the Society for Simulation and Healthcare for the Press Box. Be able to interview key experts within the space, some of the SSH leadership, and as well as key sponsors and their representatives here helping to bring this event together, which I'm so excited to share is the most attended IMSH ever in history, almost 4,200 attendees.
Crazy.
Yeah, so it's just incredible. So I'm sitting next to Jeff Evans. Thank you so much, sir, for joining us
Great
here.
To see you.
So newly appointed CEO or president?
Thank you.
What are we? President, okay, of CAE Healthcare, the division of CAE, which is one of the leading manufacturers and providers of aviation simulation equipment, so certainly they know a thing or two about simulation and how it works, because in aviation, it's fully mandated, fully regulated, and they are utilizing simulation across the board. So really excited that CAE is a part of the infrastructure that is this space. So tell me a little bit, Jeff, about what's happening here with regards to the CAE Healthcare presence. What's new from you guys here at IMSH 2023?
First of all, thanks so much for having me. Really appreciate it. So we're excited to be here for another year, and congratulations to SSH and everybody for obviously the attendance that we have. Please come over to the booth at any point in time. Vimedix continues to be just a huge game changer for us in the ultrasound simulation market.
Awesome.
New features and benefits as we think about that, just creating realism in that space. And then really as we continue to pair, we know that the physical aspects of simulation are not going away, but that being the opportunity to continue to take the digital piece of that and really complement the physical piece of that. Maestro Evolve, we've had for the last couple of years as we think about that. That's in the instructor-led learning space,
okay.
From a remote perspective, so looking at virtual and remote, which is great. And then also Maestro Embody, which we continue to work on, which is really virtual patients in the self-directed learning space as well.
Okay.
So
I've
giving
seen a little
individuals,
bit of teasers on that on some of those CAE Healthcare webinars on the HealthySimulation.com Learn platform. So excited to see a lot more of that. I know that's something that you all are working on now. So and that just expands, the turnkey solutions that come from CAE Healthcare from start to finish. And I know there's some simulation programs that have really worked directly with you guys to help them build from A to Z an entire simulation lab, or center, really, in terms of a program. So that's fantastic to see as well. You're continuing to expand and innovate as a company, and I think that's so important. On that topic, what do you guys see at CAE as trends in the industry into 2023 that you guys want to lead and be ahead of or a part of?
Yeah, I think look around at IMSH, right? I mean, you talk about all of the futuristic type of work in healthcare simulation, the folks thinking about AR and VR in a different way. We want to lead in that space. And furthermore, we want to start to take a look at how do you integrate, right? How do you integrate patient simulators with AR and VR technology, remote learning, and how do you bring that together? How do you take the data points around an individual learner's journey? How do you affect learning efficacy? How do you really get into the world of adaptive learning? By taking all those data points, putting them into some place and starting to really get insights from them, right? Even overlay artificial intelligence in the future to really create different instances to accelerate individuals' learners' journeys, or to take a look at cohorts in a semester of who's doing better and how do you continue to get better in regards to your programs for educators, get educator capacity, which is obviously a huge deal as well. So. A lot of really cool things that I think we can do as we integrate these technologies together.
Right. Once you make one seamless tool that kind of can be utilized for a plethora of different activities, it starts to simplify the process. That's going to expand usability. That's going to expand performance improvement opportunities. We have to make these things easy to use because clinicians and clinical educators got enough to worry about without having too much concern with regards to different pieces of technology, when we can have one kind of encompassing umbrella to help us accomplish a lot of that. So I definitely see that. We've seen through surveys that we've done over the past year that the impacts of COVID have really led to an increase in the utilization of remote and distance-based learning technologies. And so I'd love to learn a little bit more about specifically what is CAE Healthcare looking in expanding in the remote and distance-based kind of technical sector, if you will.
Yeah, a couple of the platforms that we talked about, right? Evolve, Embody. Our big thing is how do you take the individual mannequins that you have today based upon a physiological engine, right? The mathematical equation of how human body actually interacts with equipment and medicine. How do you take that and how do you put it on the physical mannequin itself, which we've been doing for a number of years? And then how do we embed that into Maestro Evolve and Embody, right? So you create those digital twins and you have the ability, if I'm in my dorm room, I'm in my apartment, and I have the ability to go and learn and practice before I actually get into the simulation center itself.
Exactly.
Really lower some of those stress levels and give individuals the ability to really learn in a
Right.
better way.
Yeah.
I think the other pieces of that, right, is the adaptive piece on when people learn and how they learn.
Right.
And getting deeper into that piece to really make it, frankly, go faster.
Right, and I mean, I think, you know, we're going to keep and maintain those levels of highest fidelity with the full mannequins, the team-based communication opportunities, and a real full mock code or, you know, IPE events. You know, really have continue those, but we're seeing an expansion of these digital-based learning technologies that we can be doing, you know, anytime, anywhere, with anyone for anything, and so that will help us to improve the outcomes that we have with the investments that we've made into, you know, mannequin-based technologies for those really important things. So I think across the board, we're going to see these kind of continued expansions. So great to know that CAE Healthcare sees that as well and wants to be a part of that moving it forward. Lastly, you know, Jeff, I'd just love to know your thoughts on, you know, what do we need to do as an industry to kind of move the field forward from this point? What do you think we could do collectively or collaboratively to move things forward?
Yeah, being a part of the industry now for 18 months, it is an incredible group of people that have a lot of opportunity, I think, to continue to focus not only on healthcare simulation, but on quality and patient safety and actually the acute care setting as well. I think we've got to continue the advocacy program that SSH is really promoting. All of us getting together as vendors and partners with that, I think, is a really big deal.
Yeah.
We've got to continue to focus on the individual components of this digital evolution, the new generations and how they learn. I think that's a key component of how all of us can get better to really promote learner proficiency and what that looks like. And then I think we've also got to learn from our aviation past and being a part of big CAE and a part of our aviation brethren.
Right.
We saw massive change in the 70s as you think about federal legislation.
Exactly.
I think the more that we can continue to do to lobby for quality and outcomes and patient safety through usage of healthcare simulation, I think will be better for all of us, and at the end of the day, better for patients.
Yeah, and you know, the timing on everything that you just said is so important, because right now, folks, there are House bills being proposed on the floor for the development of a National Patient Safety Board. You know, just like there is a National Transportation Safety Board, so this would be a federal level agency that's going to start to take a look at what's going on with patient safety, and I think certainly now is the time for us to be coming together and help representing our industry, because I'm pretty sure we're part of that solution in terms of improving those outcomes.
Completely agree.
Thank you, Jeff, so much for you know, for sharing with us here today for the interview and for participating and bringing CAE and all the wonderful equipment that you have here and supporting the event and the show. Fantastic to know that IMSH 2023, the largest ever attended, and CAE is a big part of it. So thank you so much, sir.
Thanks for all you're doing. We appreciate it.
Appreciate it.